My name is R Eberlin. I'm a plastic hand and peripheral nerve surgeon at Massachusetts General Hospital in Boston, and I'm here today to share with you our manuscript entitled Peripheral Nerve Surgery in Patients with the Label of Complex Regional Pain Syndrome in the Extremities. The genesis for this paper is that I see a lot of patients with neuropathic pain sent to me with the label of complex regional pain syndrome. And I've noticed over the years that many of these patients have demonstrable peripheral nerve problems that can be addressed. So in this study, we looked retrospectively at more than 50 patients sent to me over a 5-year period with the label of complex regional pain syndrome. And we tried to do a few things in the study. We looked at their diagnosis and looked retrospectively using the Budapest criteria to determine if they actually had a diagnosis of complex regional pain syndrome. And we did this with 2 peripheral nerve surgeons and 1 pain management physician. The second thing we did was to look at how these patients did over time. Did they undergo surgery? Did they not? And how did they fare? And how were their outcomes over time? What we found in this paper was that the minority of patients sent with the label of complex regional pain syndrome actually had a diagnosis of CRPS based on objective Budapest criteria. And about 2/3 of the patients sent with this label of CRPS underwent surgery, and the majority of those, almost 70%, improved following surgery. So I would say in total, this article I believe is important because it calls into question the traditional perspective that patients with complex regional pain syndrome, or a label of it, should not undergo surgery. And I think this article provides hope for many patients in this challenging situation, and it lets other surgeons know that there are identifiable nerve problems in many cases, and there are peripheral nerve solutions for many of these patients where we can help them get better with their life. I hope you enjoy the article. Thank you very much for watching.